Good evening, everybody. Let's see. It is just about 5 o'clock on Monday night. I have been teaching EMR all day, so I'm a little bit bagged. And of course, I'm getting ready to watch my Leafs hopefully win Game 7. If you are out there and you are a hockey fan, please pray for me because we need to finally win a series. But I just thought I would hop on because something that I've seen rolling around on the Facebook this week was a lot of discussion about when you are taking continuing education. Jocelyn, you're not allowed on here anymore if you're going to boo my Leafs. Sorry, you're going to have to go. And especially after I fed you wine and watched the game the other night. I can't believe you'd come on here and boo them. Anyways, so some of the stuff that I saw floating around over the last few days was a lot about when we're taking continuing education, and saw some great comments from Stevie Barr, from Eric Purvis, from Jocelyn Lauren. Final give you the shout out, even though you're talking shit about my Leafs. And then I made my own post as well. So unfortunately, there's a lot of courses within our profession that are based on research that was done many years ago, and isn't really relevant anymore. And you have to give a certain amount of credit to the people who did that research so long ago, as hopefully at the time they were trying to do their best for the profession and trying to do their best for patients by doing whatever research it was they were following. But so many of the things that that research was done on, and so many things we were taught in school, aren't really relevant anymore. So much of it has gone by the wayside, and unfortunately a lot of it comes from people who based a lot on their clinical experience. Now, don't get me wrong, clinical experience is very important, especially as an evidence-based practitioner, to be evidence-informed. We have to give some, what's the word I'm looking for? Oh, my internet bugged out there for a second, so hopefully we're back on. Yeah, it's still live. So much of it was based on opinion, some of this stuff. But back to our clinical experience being important, because quite often we've done things that we've seen work for some patients, and we treat the next patient who comes in the same way because we see something that has worked. And a lot of that has to do with contextual factors, with the confidence that we have in doing a certain technique, the confidence we have in communicating with patients. And we might just be doing a style of treatment that that patient really likes. But we can't decide to ignore the latest research that's coming out as instructors. And one of the things that Stevie Barr made a really good point of is people in our profession, we have to take a certain amount of continuing education. And if you're a instructor or a presenter, you really owe it to the people taking your courses to stay up to date, because they're paying you good money. They're paying you very hard-earned money to come and take your course and to invest in your knowledge. And while your clinical experience plays a part in that course, you had better be able to back it up with relevant current research and data that shows that what you're teaching is relevant and that it's going to help patients. We can't continue to base things on research from so long ago that was more based on opinion, not based on quality research methods and quality ways of developing the content. So if you are deciding to invest your money into a course, one of the things that we talk about quite often is when we're teaching a course is that you should be willing, or you should have the ability to call us out if you need to question us on things. And I think that's true with any course that you take. You should be able to question the instructor. And it's not meant to be done in a disrespectful way by any means. But if you can't get your questions answered, and not all of us have all the answers, but the instructor should be willing to say, I don't have the answer to that, or I'll find the answer to that. I'll look up the answer to that question that you may have. However, if the instructor is going, well, my clinical experience says that this is the way to do it, probably not the best answer, because that really is playing a small role in what is going to help your patients. So any instructor that you're sitting in front of should be able to cite some research, give you some research that you can look at yourself, but at least have something that's current that they can say, well, this is what it's based on, and this helped at least create or confirm my bias in that certain thing, whatever the topic is. And we all have our biases, and we all need to challenge our biases, and sometimes it feels really good to have your biases confirmed. And there's nothing wrong with that. But we have to be willing to challenge things, and we have to be willing to change. And as instructors, we have to be willing to change. We can't continue to teach the same thing without ever changing it, because as the new research comes out, we'd better be updating our stuff. So I'm sure that if you've been following this page for the past week, you realize that I've developed an online course based around pain and therapeutic movement that I know is going to be a benefit to anybody who decides that they want to take it, because it's going to be able to enable you to talk to your patients about pain a little bit easier, communicate the ideas to them, but also get them moving and get them back to doing those things that they enjoy, and will give you more confidence with your home care. And one thing that I can promise is all of it is backed by current research, and you will get access to all of the research that it's based on. And you will be able to question me and call me out even if you want to. Hopefully do it in a respectful way. But more than happy to have that happen, and more than happy to be able to share the stuff that we've developed over the past few years. And really, it's all about trying to help you and help your patients and help the profession get back to a point where doing movement and providing home care and a little exercise prescription, even if it's not in your scope, but to be able to talk to those patients about movement and about those things that are important is really what it's all about. Right from the point of an acute injury to understanding how to help people who deal with chronic pain, who maybe don't want to exercise because of fear of re-injuring something, or that they have beliefs that movement can damage them. So understanding how to talk to people about that and showing them that movement is going to be very beneficial, and that it's going to help them a lot, and that you can be the one who can help to build that confidence with them and for them. So the link to the course is in the comments. Hopefully no one will read Jocelyn's comments about my leaves. But at any rate, the link is there. I really hope to see as many of you there as possible, because I really know and believe that it's going to help change your practice and build your confidence as a practitioner with the most up-to-date and current research that we have based on pain and movement and exercise and how that can benefit your patients. So hope to see you all there. And even if it's not my course that you're taking, please make sure that whatever course you're signing up for, it's backed by research, and that the instructor can give you as much of it as possible to confirm that what they're trying to teach is valid, because that's really important for all of us in our profession. Okay, I'm going to go watch the Leafs game now. So please cheer for my Leafs. It should be a good game. All right, good night, everybody.